Dr. Ezon again, here with my coffee cup to talk about what I call coffee cup elbow, otherwise known as lateral epicondylitis. It's seen very commonly, especially with people when they have to shake hands or, most importantly, try to go for their coffee cup. Imagine going through the day and not being able to drink coffee. A day without coffee might be a day without sunshine. So the coffee cup elbow, otherwise known as lateral epicondylitis, is also called tennis elbow because it happens in tennis a lot. So it's the lateral epicondyle, the outside part, that bony part, but it's actually the tendon that gets a little bit of micro tears. And it's worse if you have to do these kinds of motion, palm down, and usually palm up doesn't hurt it nearly as much. So what causes this? Well, it can be due to certain things like throwing. It can be due to trauma if you happen to hit your elbow, but more than likely it's micro trauma due to a lot of exercises. Frankly, it's usually poor form in weightlifting, and it's usually poor form in tennis, where you accentuate your wrist action. A lot of times I also see it if they have poor posture. How do you diagnose it? Usually they're tender on the outside of the wrist. They're tender with what's called wrist extension. Sometimes you can do x-rays, not necessary. You can do an ultrasound, and rarely we'll do an MRI. How do we treat it? There's multiple different ways to treat it. Number one is you can just put ice on it 15 minutes 3 times a day. You can use a strap that will help to take the stress off of it. A lot of times I change the activities of the people and try to do palm up activities only. Try to get them doing postural exercise, especially some pulling type things. Ultimately, if it's not getting better, you can use different medications, both topical as well as oral. One of the newest ways to treat lateral epicondylitis of the elbow, which can be quite recalcitrant and very, very painful, is to actually use your body to help itself. So one of the problems is that the tendon doesn't have great blood supply, but we have blood all in our body. Why not use it? So what you can do is draw that off, spin it down to the best part, the platelet-rich plasma, shortened people call it PRP, and under ultrasound guidance we can put it right where we need it. It becomes like web glue, it like pulls the tendon together, and then you can regenerate that tendon. So remember, coffee cup elbow is quite painful. There's many things that we can do. Let us know if we can help, and remember, ease on down the road to good health.